introduction. Good evening, everyone. Thank you for joining us today. We are here with Dr. Uma Karjigi to talk about lupus and women's health. And as you're aware, today's session is supported by Biologics. It's part of our, it's the fourth in our series on lupus. And quick reminder on what Patients Engage is about. We are an online platform which seeks to inform, engage, empower patients and caregivers, specifically dealing with chronic conditions where we believe that the more informed you are, the better you will be positioned to take care of your condition as well as your loved one's condition. Uh, so as part of that, as I said, this is the fourth in the series. We have talked about understanding lupus with Dr. Nilesh Nolkha, and then we spoke managing lupus complications with Dr. Pradeep Kumar Sarma, and lupus young adults and pregnancy with Dr. Manish Tuggar. And today, as I said, we are here with Dr. Uma Karjigi. She's a rheumatologist currently practicing in Bangalore. She completed her specialty training in rheumatology in UK, and she's, attends various conferences and workshops, and is a member of several prestigious associations and societies related to rheumatology. She's currently practicing at Apollo Hospitals and Millennium Clinic, which starts this weekend. Just a reminder to all our attendees that the information here is based on the experience of panelists, of course, and it is medically sound, but we do not want you to treat this as a medical consultation. Please do discuss with your doctor for specific medical issues. This session is being recorded and you can see the live feed on Facebook and YouTube. You can ask your questions there. If you want to ask it anonymously, you can join us on the Zoom link as well. And we also would want to mention that there is a support group for lupus patients, which is Pan-India, just called Lupus Trust India. You will find them on Facebook, Instagram, and their number is +91 811 84 9888. There are also a few other lupus warriors which you can connect to on Instagram. They're very active and they're a good support for you if you're struggling to connect with other lupus warriors. And as always, if you have an experience to share, you can write into us at editor@patientsengage.com. And you can follow our social media pages in terms of, we are on Instagram, Facebook, YouTube, and Twitter. And just also a reminder that this Saturday, because this month is already Breast Cancer Awareness Month, we are doing a webinar on specifically focused on breast cancer in young women. That's on 9th of October, 5 p.m. India time. And we will have with us a breast cancer survivor and a gynecologist, Dr. Rohini Patil, along with 3 medical oncologists, Dr. Anita Ramesh, Dr. Poonam Patil, and Dr. Sajjan Rajpurohit. So don't forget, it is important to take care of your own health and to prioritize. So the better informed you are, the better you will be able to take care of yourself. Thank you, Dr. Uma, for joining us today. Let us get started. What is the ratio of, because our focus is women's health today, what is the ratio of men to women in the incidence of lupus typically?
So good evening, everybody. Welcome to Patient Engage program. So lupus generally affects women more than men. So the ratio we see is usually 9:1. So for every 9 female getting diagnosed with the lupus, there is 1 male. So it's much more common in women compared to men.
Okay, and typically what is the age at which lupus starts for women?
Usually between 15 to 45 years of age group. This is thought to be because of that's the commonest age when the puberty happens, and when the menarche and the puberty, the hormonal changes are happening in a female, and the 45 is an average age group where the menopause happens. So it's between these period, the menarche and the menopause is when the the age group, they're more prone to get diagnosed with the lupus condition.
Okay. And does it actually affect puberty? I know it starts at around puberty time, but does it affect the onset of puberty, or are there more? Is it more difficult onset of puberty?
Not really. It does not affect the puberty itself, or it does not even affect the menopause, or it does not affect any periods or menstrual cycles in a lady, or the
Mm,
fertility. It does not interfere with the reproduction per se. It's not the puberty will be, or the menarche will be as usual as a general population, and the menopause will be the same as anybody else. It does not really cause more problems during the menarche or a menopause. The reproductive age group also, the fertility doesn't go down because of a lupus per se.
right.
So it does not affect the hormonal as such. However, there are some things we usually try to keep in mind for a patient in lupus, especially during pregnancy, and we have to be a bit more. They need a more close monitoring and a follow.
Okay. We'll come to that later. Yeah. Given that it affects young women, especially, onset of puberty, where it's a lot happening for a young person, how does this affect their quality of life based on your experience?
So most of the time, these are the young female. Either they are studying, or they have just joined their new job, or they're just married. So they have got a lot to cope with at that time. They have if they have, she's a young mother, then baby and a family, and so she's studying, and they might be very ambitious about their career. They have to think about what job they have to get into. So it does affect the quality of life to some extent. It might cause added stress along with the stress of their career or ambition, or what they want to choose, which path they need to go to. And it's because of the lupus can cause pain in the joints, and then it can cause a lot of fatigue. So fatigue can impair their daily activities. They may not be able to do a lot more things at a time in a day, which they used to do in the past. They have to pace their activities. They have to see what they can fit in one day's schedule. And the pain can impair their activities as well. Especially the morning time might be a difficult time because of the joint stiffness.
Hmm.
So they may not be able to do a lot of things in the morning. However, in the afternoon, when the sun comes out, they might feel much better when the warmth is there, when there is during the summer days. So some days might be good days, some days might be bad days. So this can impair their quality of life, and they have to see how they're going to cope with that. And they might also need their family support in dealing with these things, and to
Right.
maintain the quality of life.
Right. Okay. And in your experience, they are able to meet their milestones of completing school, completing college, going to work, etc.
Yes, yes. There are patients who have they have going to full-time job. Sometimes I usually say if they're struggling to cope, then maybe a part-time job is a better, and then you can always take it slowly and go on to a full-time job. They do. I mean, I have patients who became pregnant, who had newborn child, a healthy baby. They do lead a normal life like anybody else. However, they will need a bit more support. And also, they will need medications along with that. So, the medications are important. Along with the medication, they can lead a near normal life like anybody else.
Right. Right. Okay. You talked of, some of the symptoms like stiffness and difficulties in the morning that affect their lifestyle. Anything else that comes to mind that you would want to highlight on that?
Symptoms can be joint pains, which we in medical term we call it as arthralgias. Most of the time, it's the small joints of the hands and of feet.
Hmm.
There may not be much obvious swelling to be seen. However, they feel it's painful worse in the morning. It gets better by afternoon, or once the sun comes out. Can be worse in in the winter timing. And night again, they become stiff. Morning stiffness is one of the common symptom. Rashes on the face, ulcers in the mouth. And
Mm.
sometimes they can present with a swollen leg, especially when the kidneys are involved.
Mm.
When there is an involvement in the lungs, there might be a persistent dry cough or a breathing problem with low oxygen level in their blood, and sometimes excessive hair loss. They complain of the lot of hair loss, along with the mouth ulcers, rashes on the face, darker pigmentation on the face as well.
Right,
And so it depends on which organ is involved. The symptoms can be different.
right. And the organs that get affected, um, are kind of that those are kind of complications that happen over a period of time.
Yes, not all of them end up in a complication involving the vital organs like a kidneys and heart,
Mm.
but these are can get involved. Like sometimes they develop a bit of a joint pain and a stiffness at the initial stage, and they might develop to involve kidneys, might need a dialysis for a shorter period of time, or sometimes if we miss the window period, long-term dialysis. And heart can get involved, the lining of the heart can get inflamed, same in the lungs as well. It can get, the lining of the lungs can get inflamed and
Mm.
leading to some additional fluid collection. So eyes can get involved. So eyes, skin, joints, heart, lungs, kidneys, all these organs can get involved in a lupus patient.
Right. Okay. Um, we are talking to Dr. Uma Karjigi, who's a consultant rheumatologist, and we're talking about lupus and women's health. So if you have a question, you can ask in the Q&A box in the um, on Zoom, or you can ask on the live feed. Um, Doctor, do lifestyle changes um, affect lupus, and what is the role of lifestyle changes?
Lifestyle changes do help, but as a supportive treatment.
Mm.
That is not going to treat the lupus. Medications are important. Along with that, lifestyle modification will help a lot in maintaining the good quality of life. Like I just mentioned about the symptom, one of the symptoms is a stiffness. So if a
Mm.
patient keeps themselves active, does, let's say, regular exercise like yoga or aerobics, then the stiffness will be less.
Right.
So the joint pain will be better managed with some regular exercises, and also the regular exercises keeps maintains your weight, keep a watch on your weight, and at the same time having a well balanced nutritious diet helps in maintaining your bone health, keeping your bones stronger. So good lifestyle is definitely works as a supportive treatment. However, it's not going to be the only treatment which is going to treat the condition.
Right. Right. Um, and there is often this feeling that if you only exercise more, if you eat better and healthier, you can control the symptoms, or you can control, and we'll come later to flares. But again, what is the role specifically on uh, diet changes that people try, and exercise as well as sleep?
So stress can flare up the lupus. Stress can be one of the contributing factors where the lupus can get flared. So if you are not having good sleep, if you are stressed, if you are worrying too much about different things, then it is one of the risk factor for the flare up.
Mm.
So having a good sleep is very, very important. So either you can try with a meditation or some relaxing technique to help with the sleep. If pain is bothering you, that's what is interfering with your sleep. You could discuss with your rheumatologist to get the pain under control. Exercise is very, very important to keep an watch on your weight, to keep your joints more mobile, to keep you active, and also it gives you a positive well. It's a feeling of positive well-being. So
Right.
exercise helps in a lot of other ways, yoga, aerobics, and diet is very, very important to maintain your bone health, to keep your joints and muscles stronger. Um, uh, Calcium rich diet, we especially say for the ladies that you have to maintain your bone health because we want to prevent the osteoporosis.
Right.
So the diet, exercise, sleep are all very, very important. You need some supportive thing to keep that going and to maintain that.
Right. And again, in your practice, have you come across any misconceptions around these?
Yes, quite a few times, a lot of the times we do come across these. It's like some people believe that yoga cures the lupus. There are a lot of misconception about the diet. They stop eating lots of food, vegetables. They stop eating, thinking that it causes pain and it causes flare of lupus, which is not really evidence based. So
Mm,
try to eat mix of vegetables, try to maintain your nutrition. They think that if I eat curds, yogurt, my pain will be more. That is not the right thing to do. You have to, curds is an important part of your diet. It acts as a probiotic. It helps with your stomach, intestine, and it also helps in maintaining your calcium intake. So there are a lot of misconception among the patients. So do discuss these things with your rheumatologist. Do not take your own decisions on avoiding food or avoiding exercises, avoiding doing only yoga and stopping all your medications. Do not do that. Do discuss all your queries regarding your exercise, diet with your rheumatologist before you make the decision on that.
right. Um, can you also explain one of the common things you hear people talk about is flares, right? So, what are flares in lupus and what triggers them?
So flares are what we call it as in a layperson term. When a lupus patient is under the disease is under control, sometimes they have a sudden flare up of the disease. Either they can have a worsening of their pain, or they can have a rash coming up all over the body or face or a neck. Most of the time, it's on the sun exposure part. So it's mostly on the face, on the neck, and on the surface of your hands and the forearm. So these flare-ups can be of any form. It can be a kidney flare-up, can be a cardiac, the heart-related flare-up, or can be a lung flare-up, joints, or a skin-related flare-up, and mouth ulcers along with the skin. So
Hmm.
flare-ups can be in any form. So any change in your clinical condition, again, consult, go and see your doctor, get a proper advice from your doctor. The things which can trigger the flare-up can be sun exposure. So one specific thing we tell about our lupus patients is to avoid sun exposure. If you're
Right.
going out in the sun, if you're sitting in a beach, try to sit in a shade, put a good sunscreen lotion, and maybe cover a good hat to cover up your face and neck area. Um, the other thing is infection. Infection can flare up the disease. So try to avoid, especially in this COVID era, we say that avoid unnecessary travel. Do
Hmm.
not interact too many, avoid going to indoor crowded places, so that if somebody else has got an infection, you can easily get it. uh,
Right.
so these stress, sun exposure, infection, these can be few of the things which can trigger the flare up in lupus.
And lupus patients, because you brought up infection, are they more prone to infections? Is their immunity typically lower?
So to some extent, because the medications trying to balance your immune system,
Mm,
so there can be a bit more prone to get infection compared to the general population who are not got a lupus.
right.
So you have to be a bit careful on how you do it. So if somebody has got very severe infection, do not go and meet them at that point. Or if somebody has got a chicken pox, then again try to avoid being in close contact with them.
Mm,
To see, nowadays we all wear masks. That's a very good protector. It protects you in from not only just COVID, it protects you from a lot of
from a
other
lot of
infections as well. So you
right,
need to take some simple precautions to keep you protected from the exposure to the infection.
right, right. And coming back to flares, I know what you talked of what you can do to prevent flares, but if you do have a flare, how are you supposed to manage them?
So it depends on which organ is involved during the flare up. So
Mm,
if it's the skin, the topical creams or sometimes we might just give a short course of a steroids to bring down the flare up, to stabilize the condition, and
mm,
then we try to titrate the background medication. What is the long term medication for the lupus? So
right.
to answer your question, so short term steroids, either topical if it's a skin, or sometimes the medication, the tablets of the steroids, and then we titrate the background medication to control the lupus in the long run, so that you don't get another flare up in future.
Right. So when you talk of, because again, you talk of skin flare-ups, etc. Again, because we live in a tropical country where sun is it's difficult to avoid. And while you've talked of uh, ways to manage it, um, how do you advise your patients who are, kind of women who are more concerned about these issues? Uh, how can they not get stressed about it, or how can they kind of, apart from keeping away from the sun, etc., are there other things that they could possibly do?
So stress, try to do like a meditation or yoga to de-stress yourself. Try to get involved in the hobbies you like to do, even though
Mm,
your mind is stressed and thinking about it. If you do your whatever you enjoy doing it, your mind wouldn't get stressed about it. Again, coming back to the sun, I would say that where if you're going out, wear a loose fitting full sleeve clothes if possible. Try
mm,
to wear a hat and a scarf around your neck. Sunscreen lotion, as I mentioned earlier, staying in a shade. Infection, as I mentioned, avoid exposure to the person who has got an infection, and try to take care of it. Simple measures of sanitization, wearing a mask when you're going in a crowded area. Avoid going in an indoor crowded area. If it's outdoor in an open air, to some extent, with the mask, it can protect you. But
right.
indoor crowded areas are the dangerous places.
Okay. Okay. Um, we've just got one question, and I'll ask it right away itself. Is contraception methods, what are the safe contraception methods for women with lupus?
So for these group of patients, usually we tell them to avoid taking drugs which has got a estrogen content.
Mm,
Initially, in olden days, we used to have all the the pills had a estrogen in it, but
correct.
nowadays there are many other options are available. So
Hmm.
you have to basically avoid the one which has got a estrogen content. So that needs to
Okay.
be kept in mind. That again, you can discuss with your obstetrician, your gynecologist about other options avoiding estrogen.
But you must let them know that you have,
You
an
must know
autoimmune
this.
condition or a lupus, right?
Yes, yes, definitely. Whenever you go to see any specialist or a physician, you need to let them know that you have got a lupus and you are on these medications.
Hmm. Right. Right. Okay. Coming to, since we started on medication, some of the common concerns around some of these medications are, for instance, with steroids, it causes what some people call moon face or slightly rounded face, etc. Um, Also, you have pigmentation of the skin with some of the medicines, and some medicines cause dryness. Um, are these kind of uh, are there ways around it, or they just have to live with it? What is your advice?
So let's start with the steroids. So that's the most common worry among the patients.
Mm,
So steroids has got some side effects. However, nowadays, thanks to the lot of research which has happened in recent years, that there are many other medications are available, which
mm,
are approved, and they have been done a lot of trial on these medications, and these medications does not contain steroids.
right.
Steroids we give it for a shorter period of time to minimize the side effects because of the steroids. So we
Hmm.
give it as a booster to bring the disease under control, and then we use a background medication which does not have a steroids. So
Right.
short-term steroids is safe to be taken. Long-term steroids is what we worry about. Like taking steroids for years and years is not a good idea, especially at a higher dosage. So these moon shape face, and getting the diabetes with it, these are all happen with the long-term steroids.
Right.
So you have to be careful. It's a short-term steroids is safer to be taken. You can again, if you have any doubt about it, do discuss with your rheumatologist before you make your decision of not to take it. There are background medications, as I mentioned, does not contain steroids, which are given in the longer term because they're safer to be taken in the longer term.
Hmm.
Coming to the pigmentation part, hydroxychloroquine is one of the drug which is commonly used in lupus. There is a lot of a good evidence for it. And a lady with a lupus who are planning for a family hydroxychloroquine helps in successful outcome of the pregnancy, to have a healthy mother and healthy baby at the end of the pregnancy. So hydroxychloroquine is one of the good drug. However, in India, in our country, we worry about pigmentation.
Hmm.
We are a country where we look at a skin
Correct.
color. Unfortunately, this question doesn't come up in Western countries. So I know that things are changing, but we worry about our skin color, skin complexion. So the
True.
one thing we can do is putting a sunscreen lotion. A patient who is on hydroxychloroquine going out in the sun, the pigmentation risk is higher.
Okay.
So you always put good sunscreen lotion, factor 50 and above, what we recommend.
Hmm.
So put that sunscreen lotion on exposed parts. That will prevent the pigmentation of the skin.
Okay. Okay. And dryness? Did you talk about dryness?
Dryness is not because of a medication per se. It's because
Okay.
of the condition itself. So
Okay.
dryness, again, putting a good moisturizer. We do recommend a medicated moisturizer if the skin dryness. Sometimes not only the skin, the eye dryness is seen, and
Hmm.
also dryness in the mouth can be seen as well.
Right.
Some eye drops, lubricating eye drops, the artificial saliva, that helps with the dryness in the eyes, skin, and the mouth as well.
Right. Right. Okay. Um, yeah, and in terms of steroids, I know that you said there is, we're not using as many steroids now, etc. But people also worry about the long-term impact on bone health due to the steroids, right? So, again, what is your advice to patients on that?
See, first of all, if you continue the maintenance drug you take, then you may not have a flare up.
Hmm.
If you stop the medications, what you are all thinking that, oh, I'm feeling wonderful, I'm feeling really great, then the chances of flare up is higher. So
Right.
if you're on a drug, continue that until and unless your rheumatologist asks you to stop it.
Hmm.
So do not stop your drug. That will prevent the flare up. Then the need for steroid won't arise.
Right.
So you can, in the first place, you can prevent the flare-ups. So if at all it has happened, then a short-term steroid is fine. It is safe to be taken. We usually either give a intravenous steroids or intravascular, or we can give a oral steroids and we taper down the dosage over few days and few weeks and we stop it.
Hmm.
That will prevent the osteoporosis and other risk factors which can develop with the long-term steroids. If you keep stopping your drug, flare-ups will happen frequently, and then you will need the steroids frequently.
Right.
So,
Right.
so you can prevent the flare-ups, thereby preventing the need for a repeated courses of steroids.
I think that's a very important thing because we often hear people, kind of when the disease seems to be stable, they discontinue even the maintenance medicines, right? So I think we would want to highlight that it is important that you continue with your maintenance therapy so that you don't have the flare ups and you don't need the more, uh,
Yeah,
the more, I guess, stronger medication.
yes, yeah.
Coming to one of the topics which keeps coming up time and time again is pregnancy, right? So, one question that we always hear is, can I get pregnant if I have lupus?
So pregnancy, one thing, it does not affect the fertility.
Hmm.
It does not affect your reproductive system.
Hmm.
So there is no reason why you can't get pregnant. Pregnancy is possible. It needs to be a close monitored throughout the pregnant. The patient has to be closely monitored throughout the pregnancy by a rheumatologist and obstetrician.
Hmm.
There are very, 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 very rarely we might say that maybe you delay your plan for a pregnancy or a plan for a baby for some time, because when the patient has an active lupus, it's not recommended to get pregnant, because the disease can flare up. It is active. We need to use stronger medication to control the disease. And during pregnancy, we are bit limited with what medications we can use. So there is, we say at least the patient condition lupus has to be stable for at least 3 to 6 months before you get pregnant. So it has to be a planned pregnancy, and we change the medication to be safer for the mother and the child when they're throughout the pregnancy.
Hmm.
So planned pregnancy with the close monitoring by a rheumatologist and an obstetrician, and managing the appropriate medication during the pregnancy. With all these things, a lady can get, the patient with lupus can get pregnant. There is no reason why they can't get pregnant.
Right. And you say that, and that was my follow-up questions is that do they need to kind of consult both a gynecologist as well as a rheumatologist? And how do they manage this interaction? Are we seeing more and more of rheumatologists talking to the gynecologist of the patient as well, or they're still kind of just telling the patient that, tell your gynecologist not to stop your medication?
No, definitely. Nowadays, we do interact a lot.
Hmm.
Especially, I mean, usually in a multi-specialty hospital, the
Right.
patients have a gynecologist and a rheumatologist on the same floor.
Correct, correct.
That helps a lot in one
Right,
way. But even I think you're already aware that there are less number of rheumatologists in our continent.
correct,
So
correct.
not all the hospitals currently has a rheumatologist.
Right,
So, but
right,
if the patient is referred from outside, we either do a letter to a gynecologist, or we just pick up the phone and we speak to them. Or we sometimes I ask the patient, when you go to gynecologist, you give me a call. I'll speak to
right,
the gynecologist. So
right,
there are a lot of ways we interact with each other. It's very, very important for the patient care and patient health.
right.
And that also gives reassurance to the patient, gives the patient a confidence that it can be managed well. So
Hmm.
it's the communication between the specialties, not only in lupus, in many other conditions, is very, very important.
Correct, correct. And I think I'd like to reiterate again. I know you said that you need to plan the pregnancy, but I think that's something that, again, it's important for our audience to know that you need to plan it 3 to 6 months so that your medications can be managed accordingly. Um, One question that I came up on that was, can I go through if I have a fertility issue which is not related to lupus or something else? Can I go through ART treatments?
Yes, there is no, again, no contraindication as such.
Mm,
Again, we usually discuss with the infertility specialist, and it has to be again a plan, because it's a pregnancy at the end of the day.
right.
So the medication has to be changed,
Hmm.
and we have to give a medication which is safer for the baby and the mother. And there are some we have to, again, if there is sometimes it can be stressful going through the process itself.
Correct, correct.
So the flare up of lupus risk can be higher during that period. So it has, again, close monitoring is important, medication changes is important. There is nothing like you can't go through the procedure or the process, but we have to be a bit careful about few things during that. That's all. That's the
Right, right. Okay. And if the patient, despite everything, has flares or the woman has flares during the pregnancy, how are they managed, and because the often worry is, will I need to take steroids, or what would, how will the management happen? And does that management change depending on, when in the pregnancy the flare up happens?
So flare-ups during pregnancy, we have to we do use steroids. Steroids is not contraindication. In fact, even in a normal patient without lupus, when they're undergoing IVF treatment or procedures, sometimes to avoid the rejection, they
Hmm.
are given steroids even though they are not lupus patient.
Right.
So there is a lot of evidence and research to say that a small amount of a steroid helps in preventing the rejection. So if they're
Okay.
having a problem, recurrent miscarriages in the past, then it is given as a protective phenomenon. So first trimester of a pregnancy, we are a bit more careful, because that's the time when the baby is developing, baby's organs are forming. So
Hmm.
we do bit, we're a bit more careful giving medication during the first trimester. But throughout the pregnancy, the small dose of steroids can be given. There is a usually we don't give very high dose ideally, but mother's health is important. When they're having a severe flare up and mother's life is in danger, then we have to go ahead, we have to save the mother.
Right.
So we have to go ahead and give higher end medications as well during pregnancy. But steroids is not contraindicated either during the procedure or during the pregnancy. If there is a flare up, we can give a short course of steroids. Again, wean it off slowly to a minimal dosage tolerated and minimal dosage safe for the baby and the mother. And at the background, again, as I said, we try to titrate our long-term medication to prevent or to protect the mother and the baby.
Right, right. Um, and this we keep getting, and we've just got again, is, um, will my baby have lupus?
Not necessarily. There is a slight risk of if your first degree relative has got a lupus, there is a slight risk of you getting the lupus compared to the general population,
Hmm.
but not necessarily that it's going to happen 100%.
Right,
So it's not like you shouldn't have children because it will be passed on to you. It's not like that.
right.
There are some depend. There are lupus will have some antibodies. Lupus patients have got some antibodies in their body. Depending on what antibodies they have, sometimes baby might get some rashes on the face or on the body after the birth. But
Hmm.
those things usually fades away within few weeks or days. So don't worry if your baby has some rashes. Go to a pediatrician, consult a good neonatologist or a pediatrician. It shouldn't cause much of a worry.
Right. And can the mother breastfeed the baby if the mother has lupus?
Yes. So again, during breastfeeding, we have to choose the right drug for the mother to
Hmm.
keep the lupus under control. At the same time, they are allowed to breastfeed the baby. Very, very rarely, we might tell them that maybe it's a if we have to give a higher end medication, or if
Hmm.
you have to give some medication which is going to be excreted in the milk, the breast milk, then we say that probably it's not a good idea to breastfeed the child. That happens in a very rarely in a severe patient who's got a severe flare up. We have to use a higher end medication in those cases. It's not that common. So some medications, when we adjust the medication during pregnancy, that are safe to be taken during the breastfeeding as well. So patient is on those medications, like hydroxychloroquine, we say it's safe to be taken during pregnancy and breastfeeding.
Hmm.
Some of the medication like azathioprine is safe to be taken. So if the patient is on those medication, she can continue to breastfeed the baby. Only when we change or a flare-up happens, severe flare-up, then only we usually tell them. Otherwise, it's safe to breastfeed the child.
Right, right. And do women with lupus have a higher incidence of miscarriage? Is there any such thing as well? Because one is getting pregnant, but the other is miscarriage itself.
So one thing I mentioned earlier is that you have to be stable. Your condition has to be stable for at least 3 to 6 months before you get pregnant, because
Hmm.
one of the risks is a miscarriage. If you
Right.
have got active lupus, the risk of miscarriage goes up significantly. And the other thing is lupus patients sometimes have a coexisting condition called antiphospholipid syndrome. It's also called, it's associated with the recurrent miscarriages, and these patients are at a risk of getting clot in their legs, lungs, or in the brain, in different parts of the body.
Hmm.
So when a lupus lady they plan for a family, we do these tests as a preconception screening things for antiphospholipid syndrome. If any of these antibodies are positive, then they will be given some additional medications and the injection to have a successful outcome of the pregnancy.
Right. Right. Okay. Um, One question that's just come in is, you know, uh, can a woman have more than one uh, birth, or can they have more than one child? So
Yes, yes,
is
yes.
there's no such risk that the so if you, for instance, if you've had a difficult first birth, do you advise them not to have a second birth, or does the risk increase over time of
If the
complications?
if the lupus flare up happens during pregnancy, or if they had a complicated pregnancy with hypertension, preeclampsia, then we do suggest that probably second pregnancy is not advisable.
Okay,
Because if the flare up has happened during the first pregnancy, there's a risk that it can happen during the
happen
second
again.
pregnancy as well. If the pregnancy was uneventful, then there is no problem. They can go for
Right,
another child. But if they had a complicated pregnancy, yes, we do
right,
suggest not to have go for another pregnancy.
right, right. Okay. Um, You talked of earlier of infections in general, but I wanted to understand, uh, do lupus patients have higher incidence or higher chance of UTIs and urinary tract infections and yeast infections?
Um, Not if they're well maintained on the medication, well controlled disease, not necessarily they're at a higher risk of having urinary tract infection.
Hmm.
Unless the long-term steroids puts you at a bit more prone for infection, like a long-term steroids or maybe having a catheter put in for a longer period of time. These are the additional factors. But if your condition is stable, well maintained, then infection risk nowadays it's not that high in a hygienic condition. You are living in a, you're taking proper precautions. Then, as such, it's not that high.
Right, right. Okay. And are they, do you advise them if they do have an incidence of uh, higher UTIs, etc.? Do you suggest any precautions for them?
Is that if they're having a recurrent urinary tract infection, that needs to be evaluated, and
Hmm.
then we need to relook at our medication part as well, and also we need to see whether there is any other causes which is causing a repeated urinary tract infection. Sometimes we say that to consult a urologist whether there is anything else we need to do apart from managing the lupus condition itself. So they will recurrent urinary tract infection will need a evaluation from the specialist.
Right, right. And in terms of I going to ask. Okay. Okay. So you said that recurrent infections. All right. And in terms of, you talked of lupus is typically between puberty and menopause. So do women find that kind of lupus kind of goes into remission after menopause? How does that play out?
Um, Usually the flare-ups are less. Not that they should stop the medication. That's very, very important message. I want to
Correct.
pass it on to the audience.
Right.
So you should not stop your medications.
Hmm.
Menopause doesn't mean that it's not going to come back. The maintenance drug needs to be continued. Do not stop the medication. The flare-up chances might be less likely to happen, but however, medication is needed. The maintenance treatment needs to be continued.
Right. Right. Okay. I think that's important because people sometimes think that, if it's not going to be active, should I uh, kind of stop the medication, right? So, okay. And typically, okay, so they continue on maintenance. Any other advice that you would want to give to, women patients, especially based on your experience and your interactions?
So it's
And I'm
derma.
just again telling people who are watching, if you have any questions, please do ask in the live feed in the comment section. Yeah.
So one thing, especially, I would like to the question which was asked more often recently is taking about COVID vaccine.
Hmm.
So these they say that because I have a lupus, I shouldn't be taking the vaccine. That is not the right thing to do. COVID vaccine is everybody needs to be vaccinated. That's the only proven preventive measure we have as of now for the to prevent COVID infection. So it may not prevent completely, but however, it makes your even if you get COVID, it will be a milder symptom. So do take the vaccine. Discuss. It has to be timed properly.
Hmm.
Some medications we stop temporarily so that once you take a COVID vaccine, your body gets enough immune response to the vaccine. So it has to be timed appropriately. So discuss with your rheumatologist. You need to take the vaccine. And when to take the vaccine. Everything is you can discuss and you can decide about that. But it's not that you shouldn't take the vaccine. It's a
Right.
very important point message, especially during this period when we are looking at maybe third wave is on the way around. So it's very important that you get vaccinated at the
Vaccinated
appropriate
people.
time.
Right. Right. Thank you. I think that's an important message for patients who still haven't got vaccinated. Um, there's one question. It's a complicated question, but I think it's worth addressing. My kidneys failed due to lupus nephritis. I also had UTI due to which the kidneys failed, or due to which we figured out that the kidneys failed. Will be going for transplant. What are the chances of lupus on the new kidney? Um, and then, does lupus not flare up after kidney transplant? What are the diet and lifestyle changes?
Lupus is a multi-organ autoimmune condition. So kidneys have affected with the lupus does not mean that the other organs wouldn't get affected. So even after the transplant, medications will be needed. Regular follow-up and to control the lupus under remission is important even post-transplant as well.
Hmm.
So kidneys are affected now after the transplant. It's not that you were cured of lupus and then
We seem to have lost Dr. Roma for just a bit. Hopefully, she will come back. So while we are waiting for Dr. Roma to, resolve her technical issues, if you have any other questions, please post them and we will address them. Seem to have.
because lupus, as I said,
Sorry, Dr. Roma, we kind of lost you for a bit. Yeah, I think you're on mute now.
yes, yeah,
Yeah,
yeah. I don't
sorry.
know whether I've completed that question or it stopped
No,
in
I
between.
think it stopped in between. So maybe you can just you were saying that it's a multi-organ condition. So
Yeah, sure. I'm sorry about that.
no, no, it's okay.
So, because it's a multi-organ condition, post-transplant medication will be necessary to
Hmm,
maintain the remission. It can still come if it's well maintained. Then with the medication, then the chances are very less.
hmm.
So, I hope that answers the question.
Right, right. So basically, lupus will not go away after transplant, and they must continue with the medication. Um, and I guess their immune, I mean, they'll be dealing with the post-transplant protocols anyway, so they just have to kind of manage that. Okay.
Transplant patients will be on medication from the transplant team as well.
Correct.
Some of those medications help in maintaining the remission of the lupus. So there
So
will be
do
some medication from the transplant team as well.
correct, correct, correct. Okay, because they will be on
Immunosuppressive,
yeah, immunosuppressants,
anti-rejection drugs.
anti-rejections. Yeah. There's also a question. Please throw some light on use of Mirena coil for endometriotic cysts. Also, medication like GnRH. What is the best option on behalf of lupus with endometriosis?
Endometriosis is a gynecological condition.
Hmm.
Uh, I'm not really up to date with what's the right treatment for the endometriosis. Mirena coil has got a progesterone. So progesterone is safer to be used, but I'm not sure in that condition whether that's the right treatment. I think they have to discuss with the
Discuss it with the
gynecologist.
gynecologist. Okay. And there is no, in your view, there is no additional risk of endometriosis for lupus patients.
No.
Okay.
Not the lupus patients are not at a high risk of getting endometriosis. That's not.
Right, right. Okay. All right. So let me just quickly check if there's any other questions. I know you talked of vaccination. I know at the moment, I think dengue is also rising in India and viral is going up. Any advice again for patients, lupus patients on that?
Um, Patients who are on immunosuppression, especially the stronger immunosuppression, even before this COVID era has started, we usually recommend a flu vaccine and a pneumococcal vaccine as well.
Hmm.
Flu vaccine yearly and a pneumococcal vaccine 5 yearly are depending on which vaccine you choose. And it's the other thing I want to message. It's not that don't go into this one that it's the end of the world. There are many treatment options are available, and the lupus patients are leading a near normal life like anybody else. they work full time, they manage their family, they get pregnant, they have babies. So it's not end of the world. You consult a rheumatologist. Early onset of the disease is the best time to get it under remission. Take your medications properly. Compliance with the treatment is very, very important. Non-compliant can lead to flare up and can lead to multiple problems in the long run. So compliance, regular monitoring, lifestyle changes to maintain a good lifestyle, diet, exercise, nutrition, maintain the relieve the stress busters, do go for a hobby. So it's not that it's your life is finished by with the diagnosis of lupus. There is so many treatment options are available. So consult rheumatologist early onset, get appropriate treatment on time.
And are you now seeing an improvement in terms of getting a diagnosis of lupus early enough, or are you still seeing a challenge in terms of, because often with autoimmune conditions we see a delay happening, right? By the time a patient gets to a rheumatologist in a country where we have so few rheumatologists. So, what's your advice on that to people who are struggling with issues and not getting a diagnosis?
It's not that it's changing. The time is definitely changing.
Mm,
We are diagnosing more and more early onset lupus, but still there are still patients who come up with a late diagnosis or at the when they're a bit advanced stage or with the complications still happens, but it's definitely changing compared to how it was before. Sometimes even after the diagnosis, when we say it's a chronic condition, you need a treatment in the long term, they tend to go off and use alternative therapies. They won't see so many other the other therapies specialists and then tend to worsen and come back. As of now, we do not have a permanent cure evidence based in any other alternative therapies. So be careful on what decision you are going to make. So once we diagnose, once we say that it is, then there, as I said, there are treatment options available and you can lead a normal life. So take a right decision in the right time.
right. And there's a question on diet, or certain foods to avoid, because the reason for that is because there's so many of these diets will say that for autoimmune conditions it's anti-inflammatory diet, or XYZ diet. So is there any evidence on what kind of foods should be avoided, or what do you keep in mind as a principle for a healthy diet? What is a healthy diet?
Just for the lupus itself, there isn't any specific diet is needed.
Hmm.
But I mentioned about a bone health. For
Right.
bone health, calcium intake is very important.
Hmm.
And the lupus patients, we always say that cover up your skin, then they don't get exposed to sun.
Vitamin.
So
Right.
vitamin D is the sun exposure is the only source of a vitamin D. So vitamin D supplements maybe just a course in a year, once in a month, or one few weeks in a year might be useful for them to take to get enough vitamin D.
Mm,
Calcium intake by taking milk and yogurt, all the dairy products has got a calcium intake. So these are very important. Do not avoid taking curds or this one I don't want to take this. So there is nothing like that. So it's calcium intake is very important to maintain the bone health. So don't restrict your diet too much. It's the all nutrition, my minerals, vitamins. You need a lot of vegetables to eat to get the protein into your body. Protein is good for the muscle mass and to strengthen your muscles. So all the food intake is very fruits is important. It will give the minerals, calcium, and also there is no restriction on the diet as such, but emphasize on calcium intake, vitamin D supplements, and sometimes we do recommend taking not a very high calorie diet. Maintain your calorie intake. That is
mm,
because we don't overweight can be more pro-inflammatory. So maintaining diet will be good. Overweight can cause more, put more stress on your joints, which are already sore and stiff. So maintaining diet, maintaining your weight
weight.
will
Right.
be important with a low calorie, nutritious diet.
Right. Okay. Thank you, Doctor. I think you've addressed a lot of questions today, and Thank you once again for your time. We also took in a lot of questions from the audience. So thank you to the audience for attending, and thank you to Biocon for supporting this initiative. Thank you once again, Dr. Uma, for your time and patiently answering all the questions related to women's health and especially for lupus patients.
Thank you. I hope it's been a helpful session.
Yes, definitely. Thanks.
Thanks. Bye bye.